Hello, everyone. Week two wrap up. We had a few technical difficulties with the week one wrap up. If that happens again, uh, by all means, either email me immediately or even feel free to text me. In the faculty information, that's my cell phone, and I have that with me all the time. I'm not always able to check my GW email as often as you like, especially if it's in the evening, and you could have just missed what I'm doing because obviously I'm juggling a number of different things, and I may not see it until the following day. So if you text me, identify yourself, and let me know what's going on. By all means, I'll either address it or I'll have somebody access my account and see what they can do to remedy the situation, so that way you can see this. Um, so week two, we took a look at three clinical monitoring models, and just gave you a good flavor. It can be significantly more complex than this, but when you're looking at trying to sort of weigh how much time should we and how complex should we make these scenarios, we have to not make it so much so that you can spend weeks and weeks doing this. I think it was Adam that had mentioned including biostats. Need to take a look at that, and data management and some of the other ancillary groups. And in a real scenario, absolutely, especially if those are going to be outsourced, then obviously that's going to be part of your calculus and calculating your budget. But in this case, we just wanted to stick with monitoring. So the three that were talked about: CRO model, sponsor model, that is that everybody's in-house and you're just going to utilize in-house personnel, and then your independent CRAs. With your CRO model, that's probably going to be all-inclusive, and everybody, the CRO is going to be, you're going to have, that's going to include your managers, everybody that's going to be overseeing the CRAs, and you just need to take a look at those budgets, and they're usually going to be more expensive because they have more personnel doing things. They're typically going to have less experience. Your CRAs are going to be less experienced, and something to take a look at, to look out for. And I've seen this with CRO, every CRO based study that I've used, is that they will often tell you that they're going to be using CRA3s. So those are individuals that have a fair amount of experience, and you're going to pay for that experience. But in reality, what you end up with are a whole bunch of CRA2s and sometimes even CRA1s. So you just need to be aware, if you have a study that's going on for a long period of time, year or 2 years or longer, that those individuals that are getting changed out, that you're getting one for one, and so that you're not losing a CRA3 and replacing them with a CRA1. And if that does happen, and don't be surprised if it does, how is the budget going to be adjusted, or that there just needs to be some negotiation, because you're not getting an apple for an apple there. Something else to take into consideration is when you're looking at these budgets, especially with the CRO, is that if they give you timelines that just seem unrealistic, and sometimes that's going to come with experience, and so hopefully you'll have an opportunity to talk with, say, a director or senior director that's going to be able to take a look at the type of study that you're doing and saying, well, number of studies that we've done like this, and this is how long it takes to say, typically monitor this and bring this amount of data in, or whatever the milestones happen to be. And if they're unrealistically short, well, then you need to apply some common sense to it. And because what will end up happening is that the reality will come very quickly, and then you'll have a scope change. That is a change in the contract, because it's going to take longer. You need a higher percentage of the monitors. Things just get very, very messy, and it's kind of like having a shady contractor who comes in and knows, well, there's a significant amount of rot behind this wall, but I'm going to tell them, so that way I get the contract, that it's very limited and it's going to cost, I don't know, let's say $2,000. And then they get the contract, they open up the wall, and say, wow, I found all kinds of stuff that I didn't expect. Well, as a contractor, you know that, or that they probably realized that it was much more widespread, but they underbid so that way they could get the contract. And at the end of the day, you end up paying a lot more because they kind of hand you. A lot of CROs will do the same thing. So as a PM, you need to be, like I said, and I'll say it again, apply common sense to a contract and ensure that it's actually realistic so you get realistic numbers going forward. Independent CRAs, typically they're very good. They've been a tremendous amount of experience, and with that experience comes efficiency. But because they're independent, they don't have, you as the sponsor have to apply your own tracking. You have to figure out how they are, how fast they're doing things. What does their travel look like? Are they doing their own travel, or do you need to be use your own personnel to be scheduling their travel? The enrollment, how fast is the enrollment going? With a CRO, a lot of times they're going to have the programs, the software to be able to track enrollment. With independent CRAs, you're going to need to be doing that. They're not going to have, they're not going to be able to track enrollment. They're going to be relying on the sponsor to be able to do that, along with a number of other things. So you need to be looking at those kinds of details when you're choosing between the two. In-house, like I had a VP who was a friend of mine, and he and I used to have lunch and talk business. And one of the things that he and I used to talk about, of course, was personnel and how much did resource cost. And of course, when everybody is in-house, as he used to say, resource is free. Well, it's not free. And so there needs to be, and a lot of companies that try to do things in-house falsely believe that is the case, and they're able to sort of shade numbers. If you really want to know how much things are going to cost, there is a lot of work that has to go into calculating how long things are going to take and how much it's actually going to cost. What percentage of your personnel are going to be dedicated to the study, and taking a look and applying honest numbers. Very difficult to really gather those numbers in-house, especially as a PM, because in order to do so, you have to be looking at other people's salaries. So that's a tough thing to do. All right, so enough with that. Going on to the next week, week 3, we're going to be looking at, budget management. And this time, you're going to be looking at, from a company perspective, why is it more important to be accurately forecasting clinical trial budgets for the duration of the study? And so there are 2 major questions. And as I mentioned in week 1, for those of you that didn't happen to see it, I like to see the question and then your response. And this also applies to the assignments, the papers, the presentations, because this is the easiest way for people to understand exactly what you're going to be doing at the company level as a PM. So you write out in the case of a paper, of an assignment, it's going to be sort of a header, and so you're going to put in your header, and then you're going to provide all the information with, as opposed to just everything, just a big block of information. Then it becomes very difficult for us, the readers, to be able to sort of pull all of that out. So from the company perspective, why is it important to accurately forecast the trial budget? Think about that and apply some common sense. It is no different than your home budgets. It is no different than anybody's budget who needs to do this accurately. And so just, I don't want to say too much, because the whole point is to get you to think, because you'll have to be doing a lot of just sort of thinking on your feet when you're actually a PM. Second one, what are the ramifications of over or under allocating money for a budget? I know that I've seen many project managers who say that, let's say that there is going to be, and I'm just picking a number out of the air. So let's say that in 1 year, you're going to spend $1 million. And there is, when you're doing this, when you're actually forecasting a budget, and whether you're doing it or whether your CRO is doing it or anybody else, it is month by month by month as to, and then there's going to be a breakdown of how much you anticipate on spending. If you get to the end of the year and you've said that you're going to spend $1 million, and when in reality you have spent $800,000, you have $200,000 that underspent. Is that a good thing or a bad thing? Thinking in terms of that, the president of the company, the CEO of the company, has told the stockholders that they're going to spend $1 million in research. Again, that it's a small number as research goes, but let's just say that that's what that is, as opposed to $1.2 million. So $200,000 over, 20% over, or 20% under. What are the ramifications of doing that? What is going to happen with that $200,000 that is not spent? And let me tell you, either way, just as a hint, it's not a good thing. I've seen unfortunately, or on some very unfortunate project managers who got very excited at the end of the year because they didn't have to go and ask for additional funds, and they found out very quickly that it wasn't necessarily a good thing. So think a little bit about that, and we'll see how everybody responds. I want you to go ahead, also take a look at the case study budget that has been attached to that we created. I created, and I need you to add some additional lines to that, at least 5 additional things that you are probably going to see in a budget. For those of you that don't have experience, and I understand that there are some of you that, and that's absolutely fine. All you have to do is Google a case study, clinical operations, clinical study budgets, and there's going to be a wealth of information in there. Lots of universities put information out there. Start taking a look at it and see what you come up with. And remember, as always, compare and contrast with at least 3 other people. More is better. Don't spend all of your time doing that, because remember that there is going to be exchange between those 3 people, and that takes a lot of time, up to and including myself. As always, if you have any questions, feel free to reach out to me via email, text if the timing is crucial, but email is fine. And so good luck, and we'll see you on the discussion board.